Good afternoon. Today's briefing on COVID-19, the novel coronavirus, will feature two speakers, Dr. Jennifer Russell, Chief Medical Officer of Health, and Premier Blaine Higgs. Bonjour. Pour la séance d'information aujourd'hui sur le COVID-19, le nouveau coronavirus, nous aurons deux intervenants. Le Dr. Jennifer Russell, médecin hygiéniste en chef, et le Premier ministre Blaine Higgs. Dr. Russell.
Bonjour, good afternoon. As we continue to manage the COVID-19 outbreak in New Brunswick, I want to thank all New Brunswickers for the sacrifices they are making to help us flatten the curve of the disease and slow down its progress through our population. I'm pleased that the New Brunswickers are taking seriously the state of emergency announced yesterday by the Premier, and it is imperative that this continues. Je suis heureuse de constater que les Néo-Brunswickois prennent au sérieux l'état d'urgence décrété hier par le Premier ministre. Il est essentiel que cela continue. Je ne le répéterai jamais assez, restez à la maison autant que vous pouvez. I cannot stress enough, stay at home as much as you can. Staying home and maintaining social distance can and will save lives. But keeping social distance does not mean we are unable to maintain our social responsibilities. Aujourd'hui, je tiens à rappeler aux Néo-Brunswickois qu'ils peuvent tous apporter une aide infiniment précieuse au système de santé en donnant du sang. L'approvisionnement en sang est déjà essentiel à notre système de santé en temps normal, et ce que nous vivons n'a rien de normal. Nous devons nous assurer que du sang est disponible quand et où il est nécessaire. Je demande donc à chacun de vous aujourd'hui de prendre ses dispositions pour faire de dons de sang. Today, I would like to remind New Brunswickers of something that they can do that is of immeasurable benefit to our system, to give the gift of life by donating blood. Maintaining our blood supply is vital to our healthcare system in ordinary circumstances, and these are not ordinary circumstances. We must ensure that blood is available when and where it is needed, and I appeal to all of you today to arrange to make a blood donation. I am assured by the Canadian Blood Services that arrangements are in place for people to give blood safely, observing social distance protocols. This is something we can each do to serve our province and its people. And I'm glad to report today that there are no new presumptive cases of COVID-19 in the province. There are still 11 cases in the province and 7 confirmed and 4 presumptive. Je suis heureuse d'annoncer aujourd'hui qu'il n'y a aucun nouveau cas présumé de COVID-19 dans la province. On dénombre toujours 11 cas au New-Brunswick, soit 7 cas confirmés et 4 cas présumés. I know that many of you have questions in this time of uncertainty. If you are wondering, how do I know if I have COVID-19 virus? There is now an online tool to assess your symptoms. The symptom assessment tool is at the gnb.ca coronavirus page, and it offers useful advice on how to respond based on symptoms you may have, whether you should seek medical assistance immediately, or to get help soon, or to isolate yourself from others. Using this tool will help you determine when you should call 811, which will reduce the volume of calls we have seen from people seeking basic information. For those returning to New Brunswick, an information sheet is being provided at airports to inform them of the state of emergency and their responsibility to self-isolate for 14 days after returning to the province. I also want to assure New Brunswickers that additional resources have been deployed to the 811 line to speed up response time to calls. Je tiens également à assurer aux Néo-Brunswickois que des ressources supplémentaires sont mises en place au 811 pour écourter le temps d'attente. New Brunswick is committed to doing everything possible to ensure we have enough ventilators to serve the needs of our population. However, the number of ventilators in our system is irrelevant if we do not do our part as citizens to behave responsibly and observe social distancing and do our part to flatten the curve. I know these are stressful times for all of us, and we are learning as we go. I want to say a few words about self-isolation. Understandably, this is a new concept for most of us, and there is some confusion in the public about what it means. For those who have been told to self-isolate, including New Brunswickers who are returning from outside the province, it is important that they stay in their home and avoid contact with people outside their families. They should not be getting their own groceries and other supplies, but they can step outside for a breath of air, we all need that, without endangering their neighbors. We can get through this by looking out for each other, but we must also remember to look out for ourselves. Mangez sainement, faites de l'exercice régulièrement, dormez suffisamment. Restez informés, mais évitez la surcharge d'informations, surtout dans les médias sociaux. Notre résilience et notre détermination sont mises à l'épreuve actuellement, mais nous pouvons faire reculer l'épidémie de COVID-19. We can look after each other and ourselves. We are proving this every day. We are in it for the long haul, but we are in it together. Thank you very much.
Good afternoon. Bonjour. Right now, across this province, people are working hard, stocking shelves, bringing in groceries, driving buses, collecting garbage, working in our hospitals and our healthcare centers, working in nursing homes, doing so many different things so that our lives can function as normal, at least as normal as possible. Présentement, dans toutes les provinces, les gens travaillent fort. Elles remplissent les intérêts, sont derrière les cases. Enregistrent, conduisent les autobus, collectent les déchets, font toutes sortes de choses pour que nos vies soient aussi normales que possible. There are also people working in agriculture and fisheries, seafood production and processing, as well as agricultural production. These services and the people who make them possible are vital to our provincial and national supply chain. Much of this work is behind the scenes, but others are dealing with the public day after day in the grocery stores, pharmacies, and food service. I want to take a moment to thank all of these dedicated workers on behalf of all New Brunswickers. It isn't easy to go to work when many are being told to stay home. I appreciate that you continue to do so, and I know that all New Brunswickers do as well. I've been proud to witness firsthand the professionalism of our public service. They have risen to the challenge and are to be commended for their unwavering support to New Brunswick. It is imperative that the rest of us do what we can to help these people stay healthy. If you're not feeling well, ask someone else to go to the grocery store or pharmacy for you. Il est indispensable que le reste d'entre nous faisons ce que nous pouvons pour garder ces gens en santé. Si vous ne vous sentez pas bien, demandez à quelqu'un d'aller à l'épicerie ou la pharmacie for vous. I want to take this opportunity to remind employers and workers of their responsibilities under our state of emergency. Health and safety at work is especially important in these times. Employers need to take precautionary measures to reduce the level of exposure, practice good workplace hygiene, allow workers to work remotely if possible. Employers, public and private, must take these responsibilities seriously. We are counting on you. If anyone has any questions or concern about employers who are not complying with these recommendations, please contact WorkSafe New Brunswick. While it is important that businesses are doing their part, it is important that individuals are as well, including those who are returning home after being away. Canadians returning home from other countries must self-isolate for 14 days. We have many members, many family members, many friends and acquaintances that are returning from the South, coming back home. I just want to encourage each of them to take the special precautions necessary. If you're returning by air, have a family member drop off a vehicle at the airport for you rather than pick you up directly. It's your responsibility because this is the next big wave of potential viruses entering into our province. And we need you to focus on keeping yourself isolated. Let your friends, let your family pick up groceries and deliver them to you. We've had examples we're seeing firsthand at the airport where people are coming home and they're getting into cabs or they're getting into a car with friends and neighbors and they're being driven home. Let's not expose ourselves any more than absolutely necessary. Having a vehicle there waiting for you to drive home yourself is the most assured way to keep separated. Do not go to the grocery store yourself when you return. I've heard stories of that as well. Just picking up groceries, just got back from the south. You know, you may want to greet your friends and neighbors. You may think that it's just wonderful to be home, and we're glad to have you home. But we want to have you for a long time, and we want to ensure that you follow these health rules so that we don't incur any increased risk. This is for everyone's safety, and it must be taken very seriously. And I'm sure there are friends and neighbors that can help each of us to do what we must to ensure that 14-day isolation is kept. Declaring a state of emergency in our province was not a decision that we took lightly, but it was a necessary step to ensure all New Brunswickers understood just how serious this situation is. Déclarer l'état d'urgence dans la province n'est pas une décision que nous avons prise à la légère, mais c'était une étape nécessaire pour assurer que nous, les gens de Nouveau-Brunswick, comprennent la gravité de la situation. The decision has resulted in a lot of calls about what can stay open and what can close. We need to ensure that essential services such as gas stations, grocery stores, pharmacies, automotive repair, post offices, and hardware stores stay open. Food and beverage serving businesses will only offer takeout and delivery services. Hotels, motels, inns, and beds and breakfasts will still be offering rooms. Telecommunication providers, construction and maintenance businesses, call and contact centers, cleaning contractors, security agencies, news gathering, laundromats, office supplies, taxis and delivery businesses, among others, will continue their operations. There is a lot of information and changes are happening rapidly. We encourage businesses to call 1-800 number for the Business Navigator line to get answers to any questions they have. That number is 1-833-799-7966. They can also email nav@navnb.ca for information. As well, there is a link on the COVID-19 page on the Government of New Brunswick webpage, specifically for businesses. On the business side, I have some updates. WorkSafe NB is waiving premiums for business for 3 months. WorkSafe NB will continue to work collaboratively with businesses and employers to help them through this difficult time. WorkSafe will continue to be part of the solution, and they will also visit work sites to ensure that the compliance, but also to help employers to ensure their employees are being able to perform their duties safely. Though business property taxes are required to be paid by May 31st, we will review late penalties on a case-by-case basis to see if the penalty can be waived due to undue financial challenges, such as having to close a business due to COVID-19. Banks are working with personal and small business banking customers to help them manage challenges that some are facing during paid disruptions during the outbreak. This will include a deferral of mortgage payments for up to 6 months and provide some relief to other credit products. Through the department responsible for labor, we are creating critical sector adjustment committees to help minimize the impact felt by any closures, and we are working with companies to mitigate impacts felt in infected regions of the province. We are committed to identifying the needs of employers to improve their capacity for dealing with human resource issues. We know that despite the state of the emergency, there are certain services that government must continue to provide. Nous savons que malgré l'état d'urgence, certains services gouvernementaux doivent continuer à offrir des services. And I know there have been questions about NB liquor and cannabis NB remaining open. And I appreciate the efforts that are being put in by the employees and the employer in this regard. The concern here is not allowing the black market to explode at a time when we certainly need to maintain control of activities in our province. So I thank the employees all through the province that are making the special effort in order to ensure that New Brunswick can continue to function in these difficult times, but as normal as possible. Service New Brunswick provides over 400 of these services to the public on behalf of other government departments and agencies. The majority of these can be done online and through teleservices, and these options must be your first choice. However, we recognize that some essential services cannot be done online or over the phone. On Monday, a limited number of Service New Brunswick centers will reopen for essential transactions only. Transactions that are deemed essential and that cannot be done online or by phone. Customers will be screened before entering, and if their transaction is not essential or can be done online or by phone, they will not be permitted to enter. The list of essential services that will be offered at the service centers is listed on the Service New Brunswick website. La liste des services essentiels qui seront ouverts au centre de services seront énumérés dans le site web des services Nouveau-Brunswick. All levels of government continue to work together to find ways to lessen the impact of COVID-19 on people across this country. Earlier this week, the federal government introduced new measures to support workers and businesses through Canada's COVID-19 Economic Response Plan. These measures include an emergency care benefit that will provide income support to workers who must stay home and do not have access to paid sick leave. Workers who are not eligible for employment insurance, such as some self-employed workers who are unable to work due to being sick, quarantined, or having to care for a sick family member, will be eligible to receive $900 biweekly under the emergency care benefit. The federal government also announced an emergency support benefit that will provide income support to workers who are not eligible for EI and who are facing unemployment. Seasonal workers who are no longer eligible for EI may be able to access the emergency care benefit or the emergency support benefit if they are eligible. Low and modest income families who may require additional help with their finances can apply for a one-time special payment through a GST credit. Families with children will be eligible for increased Canada Child Benefit payment amounts. The federal government has also announced a 6-month interest-free moratorium on the repayment of Canada's student loans. This will also be the case for provincial student loans. Le gouvernement fédéral a également annoncé la suspension de remboursement des prêts canadiens aux étudiants sans accumulation d'intérêt. Ce sera également le cas pour le programme provincial des prêts étudiants. We have requested that the federal government consider the deferral or waiving of HST remittances, EI, and CPP remittances for 3 months, or as long as may be required to help small businesses with immediate cash flow needs. I encourage anyone who needs support to make use of the economic measures being put in place to help you and your family get through this difficult time. J'encourage tous ceux qui ont besoin de support à utiliser les mesures économiques mises en place pour qu'on puisse vous aider, vous et votre famille, et surmonter cette période difficile. Though some provincial services have been halted temporarily, others have not. I want to remind New Brunswickers that social workers at the Department of Social Development continue to provide essential services to protect children and adults. This means they will continue to need to visit homes where the safety of the children or adults is possibly at risk. The department is taking all precautions to ensure the safety of its employees and the public. We would ask the public to continue to remain vigilant and to very promptly inform social development of any situation that causes them concern for the safety of children or adults. I understand that New Brunswickers are concerned. Please know that the health and safety of the residents of this province continues to be our top priority, and we will continue to make decisions with that being our focus and our primary goal. I encourage everyone to continue to follow the recommendations of public health and to take care of one another. J'encourage tous les membres à continuer à suivre les recommandations de santé publique et de prendre soin les uns des autres. Thank you. Merci.
Michel Corriveau.
Bonjour, j'ai une question pour Dr. Russell. J'aimerais savoir, Mme Russell, au niveau des hôpitaux dans la province, combien il y a de lits libres ou est-ce qu'on a suffisamment de lits libres? On apprenait ce matin qu'à l'hôpital de Moncton, il y en avait 50 qui ont été libérés. Qu'en est-il pour les ventilateurs, les masques et le personnel médical disponible?
Alors, au sujet des lits, je n'ai pas un exact nombre devant moi, mais je sais que toutes les choses que les réseaux font au niveau de diminuer les services non essentiels à ce moment-ci. Ça, c'est des choses qui sont faites avec le but de donner le nombre maximum de lits possible dans le système. Alors ça, je sais que ça, c'est des choses qui sont des choses qui sont déjà faites et ça va continuer à être fait. Au sujet de l'équipement pour les employés, aussi, je sais que l'information qu'on a avec les réseaux et avec nos planifications, c'est j'ai pas de crainte à ce moment-ci qu'on n'a pas assez d'équipement à ce moment-ci.
Michel, as-tu une suivi?
Oui, j'aimerais poser une question à M. Higgs. Monsieur Higgs, est-ce que vous avez envisagé la fermeture des frontières entre les provinces?
Peux-tu répéter, s'il vous plaît?
En anglais, s'il vous plaît, monsieur.
Have you considered to close the frontier between provinces, and do the province has the power to do that, or do you have to, is it Ottawa who could do that?
I guess certainly, Michelle, we'd want to have that as a discussion that all provinces would consider. We've had in my calls with my colleagues and with the Deputy Prime Minister, discussed cross-border movement. I mean, we've limited, as you know, all government employees are not to travel outside the province. We're certainly, as most are at home at this point in any case, but we're not doing any outside province travel. We will restrict that if we see that necessary, but I would be encouraging that to be a countrywide kind of imposition on citizens so that we collectively agree that we need to maintain the situation and control it within our own borders.
Thank you, Premier. Thank you, Michel. Merci, Michel. Elizabeth Fraser, CDC.
Hi, my question is for Premier Higgs. You mentioned setting up a line for people to report problems or people not following the rules. Would this apply to both businesses and individuals? And what has the government set up to respond to the calls in terms of enforcing the emergency rules?
So if you go onto the government website, you'll see there is a section there related to businesses and a section related to questions or concerns. So we are monitoring that daily. And the idea is that we have a kind of a rapid response team that's addressing particular concerns. And if it's, advice in the sense of people are not following the rules and they're just saying, we're concerned about this sort of activity, it can also be reported there, and we'll certainly follow up on it. We're just looking to, as I mentioned about following with some of the WorkSafe surveying with some of the companies and ensuring their employees are safe. We know that employees and employers are anxious about health concerns, as they should be, as we are, in trying to maintain a balance between people that are not necessary to be out and moving around and to keep, a resemblance of our economy moving in a very respectful and a way not to jeopardize health. We want to ensure that we're all paying attention, and any ideas that are brought forward are welcome and will be reacted to promptly.
Thank you. Elizabeth, do you have a follow-up?
Yes. This is my question again for Premier Higgs. Is there any update at all on transferring ALC patients into nursing homes to give hospitals for breathing room? And has this started, and is there any sort of timeline for this?
It has indeed started, and at this point it is going well. And I think out of the total, we're probably about 50% along the way.
Thank you, Elizabeth. Thank you, Premier. Adam Harris, Brunswick News.
Thank you. Each province appears to be reporting differently where people with confirmed cases of COVID-19 live. Some are reporting more granularly with cities and town names being used. Others are using large health sector boundaries, like in New Brunswick. Dr. Russell, is there any reconsideration of New Brunswick's policy if the number of cases grows? And to both Dr. Russell and Premier Higgs, would the public not take government directives to stay at home more seriously if they were informed of a case in their community?
Very good questions, Adam. And certainly, again, this is an evolving situation, so I can definitely see considering those options. And I hear what you're saying about the public and what they understand and hear around cases and the reporting of cases. I think because the situation is evolving and the fact that we know that there will continue to be travelers arriving in this province, all areas of the province, who are at risk of bringing infection with them, I think that's why the message needs to be province-wide around staying at home and following these messages. Because we can't predict, again, which location we're going to see a case pop up. We do have to be prepared for that in every corner of the province, and that's why every New Brunswicker needs to be taking the same steps to protect themselves and their families while this is happening, while this is evolving.
Adam, do you have a follow-up?
Yes. Premier Higgs, you said in the last few press conferences you were reviewing the federal aid plan for any shortfalls. Have you found any?
Yes, we have, but I still would like to commend the federal government for their actions to date. You know, certainly, as I've mentioned before about the restrictions around the border, the recognitions of our trade with Maine, the recognitions of, you know, particularly the residents on Campobello Island, the need for this movement of north and south. But going through the package in detail, I did mention a few items today, you know, about the student loans and then some of the packages that are there for businesses. But I think we're still going through, and we'll come out with more details as we go on, because we're going to be very focused here. You know, this is not about let's just say how many things can we put places for money. We want to make sure that people can rest assured, that people can say, look, we have supplies, we're not a problem, and because we're being certainly convinced that that is not the case. We don't have a shortage of supplies. We need to manage that. We need to manage the healthcare curve so we don't get in trouble in that regard. Also, I don't want people concerned with their finances. So we see the package is very focused in relation to individuals and how we can ensure that they are receiving adequate compensation and they can carry on with their lives and business as normal as it can be in these trying times. The other aspect that we don't want to miss are there are so many companies that are impacted here, and small businesses I'm talking about, that we want to make sure that they have the capability to restart and our economy can once again get floated and back in business. So they employ a lot of people, and I'm talking about the smaller companies all over this province. So we're analyzing this for a balanced approach to ensure every citizen is protected, but equally a company is not saying, well, I'm now done. I'm actually able to survive this this bubble or this wave and then get back in line and employ people.
Thank you. Thank you, Adam. Geneviève Normand, Radio-Canada. Geneviève? Okay. Silas Brown, Global TV.
Dr. Russell, you spoke about people trying to take care of themselves. What can you kind of tell people who are spending a fair amount of time inside and in their homes right now to try and keep healthy and keep busy?
Well, I think a couple of things. Number one, probably a good idea to get outside and get some fresh air, number one. Number two, I think limiting time with respect to screen time and social media time, doing things that don't involve a computer or a tablet or a phone. And if you are going to check out resources for other ideas to keep your mental health from suffering, then again, there are resources on the GNB website during that time that you have dedicated to screen time. Look up the resources that can help you make some plans and have some structure and routine to your day, because some people are working from home right now, and that is a big shift, especially if they're not used to doing that. And then again, how you structure your day with a routine, I think, is really important. So I think there are also some resources around that as well. Board games, reading, music, hobbies of any kind, knitting, sewing. There's lots of creative ways to use your time to keep your mental health and your spirits up.
Silas, do you have a follow-up?
Yeah, I'm curious about frontline workers right now. How are you hearing that people are doing? Are you hearing about any sort of burnout in terms of nurses and doctors who are obviously pulling long hours to try and help us cope with this right now?
I'm hearing a couple of messages, 2 or 3. One message I'm hearing is great job in terms of getting the message out to the public that they need to take these measures seriously, because those are the things that help the frontline workers feel more protected and safe in terms of people doing what they can and taking responsibility for helping our efforts here. So that's one message I'm hearing. I am hearing concern about well, I guess, again, I've practiced medicine as a clinician for many years. I did my training here, so I have colleagues, mentors, friends, acquaintances in the system. So these are friends and family and people that I've known for a long time in many cases. So I think it is a small medical community, and I think in terms of burnout and support and those kinds of things, I have spoken with the RHAs in terms of making sure, I spoke with both chiefs of staffs for the RHAs to ask questions around making sure that there was access to support for people with the phase that we're in now, but also moving forward. Because again, these are the people that are most important in terms of the frontline staff, so we want to protect them.
Thank you, Silas. Keith Doucette, Canadian Press. Keith? Mike Cameron, CTV.
Thank you, Bruce. Question is for Dr. Russell. I'm wondering, Doctor, whether New Brunswick is testing enough people who are showing symptoms of COVID-19. I'm just looking at Nova Scotia's numbers. They've tested more than 1,500 people. And this may be apples and oranges, but it may not be. I mean, a similar jurisdiction to the west of us, the state of Maine, has tested more than 2,300 people. Could our numbers be artificially low just because we're not testing enough people?
That is a good question, and certainly the fact that we've just opened up 13 clinics in the province to increase our capacity to test New Brunswickers is really important. So this week we are ramping up, we are increasing our capability, so not just in terms of the number of clinics that exist, but the throughput will be able to be increased as well. And so this is new this week. Getting the bugs worked out of 811 and the resources that are needed for that have also been something that we've been working at. So I can see that the numbers of tests will most likely increase based on the fact that the system is now responding at this stage.
Thank you. Mike, do you have a follow-up?
Yes, I do. Thank you, Bruce. That's for the Premier Higgs. I understand you've been reluctant to put a timeline on any of this, but should the government of New Brunswick be preparing parents for the possibility that schools may not reopen the week after next, just so parents can make perhaps longer-term plans?
Yes, indeed, Mike. I think it's very real that, in fact, I would say here the schools will not reopen the week after next. I think that, you'll hear more about that from the education minister, but the concept that, where we are at this phase is, they're looking at alternate ways that they can have educational materials available to students at home and work. I know they're working on those programs, and so although that decision has not been made at this point, I think it's certainly very real.
Thank you, Mike. Tom Bateman, Times and Transcript. Tom? Daniel McCready, CBC.
Hi, my question is for Dr. Russell. So we've been hearing that some people are having to wait, long time, sometimes 3 days after calling 811 to hear back from a nurse. So I guess from your point of view on the 811 side, is the situation getting worse? Like, how many calls is 811 getting each day? And I guess how many new lines are you guys planning on adding?
So there's a couple of answers to that question. Number one, in order to take the pressure off 811, we now have, as I mentioned earlier, on the GNB website, we have a symptom checker and we have an online assessment tool that people can go to and find out about their symptoms and their risks and whether or not they should call 811. So that's number one. We really, really want to direct people to go there first. The second thing is we had earlier in the week increased the number of lines and had some technical issues. So again, we were up to 1,000 calls a day, up from 200. So we went from 200 calls a day to 1,000 calls a day. And as the system is responding and working out all of those things, we're hoping to see that that capacity be something that will be able to handle the flow. So between the website And between increasing the lines and the resources behind 811, we're hoping that this will help the situation.
Yeah, just to clarify, like how many lines are being added? Do you know?
I don't have that right in front of me, but I know there were a lot, and there's actually now a new outbound center. So some of the people, some of the retired nurses that have come back to work, they are now in the overflow system for taking 811 calls.
Thank you, Danielle.
Can I ask a follow-up, Bruce?
Yes, you can.
Okay, so Horizon is saying that the North End Health Clinic on Victoria Street in St. John is better equipped to be a COVID-19 testing center than the center that was set up and then closed down earlier this week at Exhibition Park. I guess, can you elaborate on this? How is that North End Health Clinic better equipped?
That is something that Horizon is dealing with right now, so I'm sorry I can't speak to that.
Thank you, Danielle. Matthew Wacomo, Lacadie Nouvelle.
Docteur Russell, ça fait 2 jours de suite qu'il n'y a pas de nouveaux cas. On est toujours à 11. Comment la population devrait interpréter ce fait-là et comment vous l'interprétez? Ça semble une bonne nouvelle de prime abord, mais j'imagine que c'est plus compliqué que ça.
J'ai pas entendu chaque mot que vous avez dit, mais je crois que je comprends la question. La question, c'est parce que dans les derniers 2 jours, on n'a pas annoncé des nouveaux cas. Et qu'est-ce que ça veut dire? C'est quelle information qu'on peut apprendre de cet fait? Alors, oui? C'est ça? Oui? OK, d'accord. Alors, dans une éclosion, comme on avait la rougeole l'été passé, au fur et à mesure qu'on a des résultats, on va vous donner les résultats. Mais pour nous, pour analyser cette information, c'est vraiment les périodes de 14 jours ou 1 mois pour assesser, garder en arrière pour dire c'était incubation period. C'est quoi le mot pour incubation period? Incubation period. OK, ben. Incubation. Alors, on peut dire, parce qu'on sait qu'il y a des gens dans la communauté qui sont revenus du voyage, que peut-être n'ont pas des symptômes maintenant, ben dans les prochains jours, ils vont développer des symptômes, ils vont se faire tester, et à fur et à mesure que ça arrive, on va trouver d'autres cas. C'est comme ça que notre système est situé maintenant pour déterminer les nouveaux cas. Alors moi, je crois qu'on va voir plusieurs cas de voyage.
Mathieu, un suivi?
Merci, docteur. Vitalité, depuis aujourd'hui, demande aux retraités du système de la santé de se porter volontaire pour revenir dans le système. Savez-vous si ça donne des résultats pour le moment, ces demandes-là? Et je sais là, que les médecins faisaient la même chose, le Collège des médecins, des trucs du genre.
Je crois que ces discussions arrivent. Je suis pas au courant des détails à ce moment-ci, mais je sais que c'est le plan pour augmenter les ressources dans le système.
Merci, Mathieu. Dan Arsenault. Dan? Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for the Premier. I was speaking with the Mayor of Campobello today, and he's wondering what will happen if a resident of Campobello Island calls 811 with symptoms and needs to get tested. Once they explain to border guards they are driving through the U.S. to re-enter Canada to get tested, will they be allowed entry, and will that be left solely in the hands of American border guards?
That's it's a very pertinent question. We've been told by the authorities that residents of Campobello will be allowed to move. Equally, healthcare workers like A and B will be allowed to transport residents from through Maine to our hospitals. So I guess without specifically talking about an 811 call, unless the doctor could add anything to that in particular, I would say that they could be transported through our A and B network and delivered right through into New Brunswick.
Vicky, thank you. Do you have a follow-up?
Yes, this question is also for the Premier. The town of St. Andrews informed me that they've been notified that if community clusters of positive patients start to occur that are not related to travel, at that point the Public Health Agency has the right to inform towns that they do have a cluster. Will this be the case if we do get to that advanced state of emergency?
So could I just get clarification on that question again?
Sure. The town of St. Andrews informed me that they've been notified that if we do get community clusters of positive patients in towns that start to occur that are not related to travel, then at that point the public health agency has the right to inform towns that they have clusters. Is that going to be the case if we get to that advanced state of emergency?
Dr. Russell?
Well, I'll definitely take that under advisement because our plan is to inform if we do have a case of community transmission, we would be informing the public right away. And at the local level, the regional offices are where the outbreak management is taking place. So I'll keep that in mind in terms of as we move forward.
Thank you, Vicki. Adam Bowie, Brunswick News.
Hey, for Dr. Russell, what, if anything, does 2 days in a row with no new cases mean?
So in an outbreak situation such as this one, and because we expect travel-related cases to continue to pop up, 2 days in a row, it doesn't mean a whole lot other than the test results came back negative. It doesn't mean that lots of tests aren't still being done. I think we're up to over 500. And so we have 11 cases at the moment. I do expect there to be new cases, again, as new travelers come into the province over the next several weeks. And so 2 days in a row, it just means that the test came back negative for the ones that have been tested.
Adam, do you have a follow-up?
I do, Bruce. I was wondering if maybe either the Premier or Dr. Russell could talk about what schools are being, what kind of preparations are happening at school, what kind of use could they be used for possibly if needed?
At this point in time, our focus is ensuring that our facilities, our current healthcare facilities be designated and be identified to respond as quickly as possible. And that's why we're making some changes with the long-term care patients to give greater capacity in our existing hospitals. Obviously, if the schools are vacant and they're buildings that we need for centers of any kind, they could be used. But at this stage, it's focusing on our current health system and exactly how do we make it more available for any sort of wave that comes through here and be able to respond very quickly.
Thank you. Thank you, Adam. Andrew Waugh, Brunswick News.
Dr. Russell, I'd like to understand how the capacity of the system is faring so far, and at what point is it possibly going to become overloaded? I mean, Dominic Carty's out there tweeting about schools being prepped for other uses. The Premier is suggesting that, obviously these could become overflow facilities. So clearly you're preparing for the system to be overloaded. Do you have any projections on when you think that's going to happen?
Well, it is difficult to predict. It is a very good question, and I guess we do have to be prepared for that eventuality. Delaying it as long as possible is our goal because we want everybody to be doing their part and we want everybody to be following social distancing and hand washing, et cetera. So all the measures that are in place right now are really designed to delay the system becoming overwhelmed as much as possible.
Andrew, do you have a follow-up?
Yeah, we spoke to Horizon this morning, and we're trying to get total numbers of ventilators for the whole province. Now, Horizon told us they've got about 95. The Talatay hasn't answered. Can you give us a firm number of how many ventilators there are for the entire province, please?
I have been told that we have 161 and we've ordered 50% more.
So, okay, fantastic. Thank you.
John Morris, did you have a question?
Negative, thank you.
Okay. Thank you, Premier Higgs and Dr. Russell. This now concludes today's briefing. Merci, Monsieur le Premier ministre et Dr. Russell. Ceci met fin à la séance d'aujourd'hui. Merci.
Merci.